So our next speaker is going to be Professor Babar Rao, a dear friend from Rutgers University, East Coast. Sometimes, I'd say not all the time, and we're looking forward to your talk.
Thank you for inviting me here, and thank you, Trilok, forcing me and scaring me that I have to be here. So, you all know what is machine vision, artificial intelligence, but this is the Oxford Dictionary definition of what is artificial intelligence. And we're using the term augmented intelligence, where machine or human working together. But these are my artificial intelligences. Every day I'm trying to learn. I ask them, they give me the information, and I absorb, and I keep going. So I don't know, many of you were watching CNN and TV and BBC in last few weeks. There was a major question like, as artificial intelligence become more popular, would it take over humans and do something really bad? So then question is, if you wrote a software or a program which then was doing something wrong, which we didn't want to do it, so there are federal, and each country have their own like regulations. Basically, if you made the product or any software or AI product, and it did something wrong, then you are responsible. So that's how they are regulating it. So there is a lot of discussion on it. It is in TV everywhere. And this is the educated community here about how these models work. And there is the machine learning and deep learning. I didn't need to go into detail. But in deep learning, basically, you don't give features and it does it itself. In machine learning, you have a feature extraction and classification. So up to now, we've been talking about AI and different studies and various studies. Let me go into a little story, like whatever is available right now, can we use it in our practice or not? To diagnose it, to look into the lab, or treatment-wise. So here is my patient, 31-year-old man, developed some fever after returning from Miami. 2 days later, developed uncomfortable blisters, and went to urgent care, and urgent care couldn't diagnose, so he came to me. So I thought, okay, for fun's sake, let's look and let's catch the apps which are available, what is the diagnosis. And there are many, many apps available. Some of the apps are where basically you'll enter your information and they'll give you your answer. Other apps are you'll send the image and they will give you the information. So I went to this very popular app. Let's see if I can run the video. Where basically if you enter the information and then keep going, and you tell them this is my photo, these are the features, they ask you feature, in the end, they'll give you the possible diagnosis. This is visual diagnosis, one of the very popular software. And they'll give you the diagnosis, so if you have to enter a few things. So based on that, when I gave to this app, I got these 9 differential diagnoses: herpes zoster, varicella zoster, syphilis, EM, all kind of differential diagnoses. However, what I was thinking as a human, maybe it was mpox or monkeypox, but they couldn't come up with that after like me spending 10 minutes with it. And but most of you know probably the most widely used algorithms for clinical dermatology were during COVID time, or right after COVID time. Then the mpox came, and there is a registry by American Academy of Dermatology where actually if you use this information, you can get the diagnosis of mpox. And there are many, many algorithms written about it, like how to diagnose. And all of them seem to be working really, really well, but the trouble is all these algorithms either written in, let's say, in Stanford or MSK or somewhere, and although they are good algorithm, but if I want to use it or you want to use it, I don't know what did they do, and I can't use it. So they need to be obviously validated. That's what the previous speaker were talking. And also in this study, they concluded basically you need a lot of information other than just telemedicine, like you should have a lab information, clinical information, and all other kind of information to make the right diagnosis. So clinically, there were 2 apps available. One app was where I send the photos up and they give me the differential. They obviously didn't do it. The other was you basically enter certain things, then you try to get the diagnosis. So AI in both cases here did not help me. How about in diagnosis like histological diagnosis or biopsy diagnosis? This is our own work. We are working on one of these models where whatever we are doing is you take histology stained images, and then you take unstained images, and then you stain them digitally. Why I want to do that? Because eventually you want to see if you can look at fungus and bacteria without staining them, and that may be fun. So here on the top is a traditional histology, and underneath we are using AI to stain my slide without staining it, basically. Now, there are models, as we were discussing earlier, for skin cancer like basal cell, squamous cell. There are some good models, but not much for inflammations. And why would you use it? Let's say I sign 300-400 cases a day of pathology, but if I have an AI instead of a fellow, AI can probably give me preliminary diagnosis, and then I can finalize it. But there are not much models on inflammations. So then what I did, this patient which I showed initially, which probably have mpox, I thought, or monkeypox, I had a biopsy on it also. I said, okay, I have the biopsy. I at that point knew most likely it would be monkeypox because it has the features. So I said, what if I throw this into ChatGPT? So I described to ChatGPT that my patient has this, and what do you think my patient has? Because I describe everything. And ChatGPT has a long answer. Let's see if it did, but basically said, sorry, my data is 2021, so I don't know what is monkeypox. So ChatGPT failed me. But luckily, in this case, I had already done, a PCR, and I sent a sample, and it confirmed that it was monkeypox. So the point being here is the current AI models to diagnose skin lesion or to basically then and give you some diagnosis or information from ChatGPT, both of them failed in mpox case because after 2021, they don't have the data. Now going into therapeutics, that's where I believe, I think I was in Barcelona last month, and you were there, and I thought currently where AI is working or will work and we are using it is in therapeutics. And so you can, I'm going to skip this one. And that therapeutics-wise, basically when we go to write a treatment for my patient, let's say in this case he has monkeypox, this is the recommended treatment. But what I usually do is, now I'm starting to ask my fellows and my residents, okay, before we write the treatment, let's look at ChatGPT or let's look at UpToDate. ChatGPT doesn't have all the information, but UpToDate is a very good app which actually gives you all this information. And now let's say your patient didn't have monkeypox or anything, let's patient have psoriasis or eczema. For psoriasis, we have like now 23 biologics or biosimilars. For eczema, we have lot of biosimilar or those. So how do you decide which biologic to give? Actually, AI is helping because there is this company, or I'm nothing to do with the company, called Mindpox, where you can send patient sample to see which it will be better for TNF-alpha or IL-17 or IL-23, and actually you can pick a right diagnosis. So that's where AI is helping, obviously. Then there are now apps coming where, let's say if you have decided, this patient has psoriasis, which biologic should I pick? It's difficult to just remember. So there are a lot of applications where you can enter, patient is 23, not pregnant, otherwise healthy, what should I do? They give you the answer for that. And that's where I'm using in therapeutics. Now this is my last slide. So if there is a skin cancer, we can diagnose it clinically, dermoscopically, but if you want to treat it biopsy-wise, cutting-wise, whatever, in United States at least, you have to do a biopsy, otherwise you cannot bill. But nowadays, right after biopsy, you can do superficial radiation and treat the cancer, and the machine comes with a ultrasound so that you can follow the tumor is gone or not. But what we are doing it now, we have already changed that equation a little bit. Instead of diagnosing it with histology, we're diagnosing with confocal. And this technology, I call it cutting edge technology without cutting, basically diagnosing clinically, and then with confirming with confocal, radiating it, and then following with the ultrasound and confocal, so whole thing done without any needles. But if you use AI even further, let me see one more slide, the last slide here. So what you can do, and that will happen, it's already happening. So I can diagnose the cancer based either via AI or tele, because there are algorithms already written, or I can also follow up with AI or tele. Only person where we're using human is in the middle, where the superficial radiation being used by a technologist. But if there is a robot which can do that, then party over. So very soon, I'm sure next 4 to 5 years, there will be a robot doing that part. Otherwise, everything is AI and tele here. Obviously, AI has its own limitations. We talked about data, accuracy, validation, and the quality. And this is my take-home message for Dr. Trillock. AI and telemedicine will inevitably become an integral part of any medical practice. So you use it or lose it, it's up to you. With that, I'm open for questions. Any questions?